Hi, my name is Bill Stewart. I'm with a company called Medicare Savings Pro, and we are an independent insurance company in the state of North Carolina. Our motto is don't expect what you don't inspect. So we can provide you with any policy that's written in the state of North Carolina for your advantage and to save you the most amount of money. Our compensation comes from the company if you allow us to direct you to the right choice after you've made it. And so this is a free service to you. Let's talk about the ABCDs of Medicare. Now, A and B are your 80-20%. That's where the Medicare pays the 80% and we pay the 20. But a big thing to remember is there's no cap on the 20%. It's unlimited that we could be responsible for. So that's the reason why there are these Medigap policies that are regulated by the government that help pay literally that gap that's created by the 20%. There's also what's called Part C in Medicare. Part C is Medicare Advantage. Medicare Advantage is kind of like an HMO. In fact, many times it is an HMO. So there's restrictions on the doctors that you can see. They have to be in the network or perhaps in the area that you can go to. There are copays and deductibles under this arrangement. But because of the fact that you're willing to take on some responsibility, the premiums can be lower and you can even get extra benefits as well. So some have found the Medicare Advantage C is an attractive alternative. Part D, we'll just mention this one time, it's your drug plan. And there is over 100 of them. So we recommend that you go directly to the government to get those. And then in that way, they'll help you free of charge and also with their knowledge to choose the right particular program. We can help guide you through those steps to do that. Now, you do need to get a hold of this publication if you haven't already. And you see that Medicare and You 2017. This is the Bible for Medicare. If you don't have it, the phone number to get a copy electronically or in written form is 1-800-633-4227. 1-800-633-4227. Now, here's your steps that you need to consider. First of all, you need to sign up for Medicare as you turn, or 3 months before you're turning 65 years of age. You need to do that so you don't, or you can avoid penalties. Now, if you're not already on Social Security, you are not automatically signed up. You have to do that. And many baby boomers are not drawing Social Security now at age 65. So it's very important that you take this first step. Now, here's some of the specifics for Medicare, and in the publication you see all the details. But basically, Part A is what's called hospital insurance. Things that you incur bills while you're in that bed in the hospital. Now, it's typically free, no premium, and that's usually the case. So that's Part A. Part B is something that's voluntary. It covers outpatient doctors, tests, scans, x-rays, etc., like that. Now, we still recommend you sign up for it now at the same time so you will avoid any penalties down the road. But there is a monthly premium. It's $134 currently a month, and there are deductibles if you use Part B. Part C is Medicare Advantage that we mentioned before. It's the only part of Medicare that has been impacted by Obamacare so far. Monies have been taken out of Part C and Medicare Advantage plans to help fund the subsidies and so forth in Obamacare. So there are limitations to this program, but there are also some benefits to be considered as well, and you can do that in the publication. I'll go into detail. Now, a Medigap plan or Medicare supplement, there's 10 of those that are standardized by the federal government. You'll find them on page 82 of your publication, and we direct your attention there. We can help you go through those later on the phone. But these are something that if you, depending on which one you choose, you could go to any doctor that you want. You can go complete no out-of-pocket expenses at all if you have one of these policies in place. Now, this is very important to remember. You have a 7-month window. That's 3 months before turning 65 to be able to select a Medigap policy or supplement. All right, and in that window, you have what's called guaranteed issue. This is the only time, well, I wouldn't say the only time, but typically the only time most of us will have to, no matter what our health concerns might be presently, they cannot stop us from getting a Medigap policy, and then we're guaranteed issue for as long as we make our premiums or payments to it. So it's a very important window to optimize and make sure you're taking advantage of. Both the Medicare Advantage and Medigap supplements, they both typically have a monthly premium. And as we said with the supplements, you can go all up and down. You'll see on that chart they have no out-of-pocket at all. So that's something you might want to consider. Here's your to-do list right here. Can you see that on the whiteboard? Number one, you need to apply for A and B 3 months before you're turning 65. Number two, you need to choose Part C or a Medigap policy. Number three, you need to sign up for Part D. And number four, you notice that that's our next video. That's the title of, to get your attention, where do you buy gas? We appreciate your time today. Hope this has helped to some degree.